This topic is factitious disorder, or Munchausen syndrome. The name tells us a lot: factitious, artificial or contrived. This disorder can be imposed upon self or imposed upon another person. Factitious disorder imposed on self is intentionally misrepresenting or causing symptoms of an illness to seek attention and emotional care. There's no external reward, like medication or housing. The characteristics include exacerbating existing medical conditions, so making a condition they already have worse. This could be done by not taking prescribed medications or taking them incorrectly. They may create new symptoms by inflicting serious intentional injuries upon themselves. They'll falsify medical records and manipulate laboratory samples. They become so skilled at presenting their symptoms that healthcare providers will think their symptoms are real and admit them into the hospital. Factitious disorder imposed upon another. This is intentionally falsifying those symptoms of illness upon a vulnerable individual, like a child or older adult. They do this to assume a caregiver role and to receive attention. The caregiver is the one diagnosed with this disorder. The characteristics include inducing illness through physical assault or giving the vulnerable individual substances that will make them sick. The caregiver may lie about the individual's medical history and contaminate their laboratory samples. The symptoms improve for the individual when the caregiver is absent. All of this can lead to severe pain, unnecessary surgical procedures, and death. Commonly falsified symptoms. You'll notice some of these would be hard for medical personnel to substantiate. We base the assessment on client report. If they are telling us something, we have to first assume they are truly experiencing that and follow through with testing and treatment. Weakness. This is a reported symptom. If you don't know the client's baseline, how can you verify this? Chest pain. If a client comes into the hospital and reports chest pain, we think cardiac issues and we'll do a cardiac workup. Hypoglycemia. We can test for this in a healthcare facility, but if a client says they had symptoms at home of shakiness and hunger, nausea, sweating, and fatigue, and then they say they had candy to treat it, we have to consider that report as truth. Joint pain, vomiting, diarrhea, and abdominal pain, this could be induced by ingesting substances that would make someone sick. Psychosis, seizures. Again, the client could report having a seizure at home, but be fine when they come in. Hyperthyroidism. Think of these signs and symptoms: nervousness, irritability, difficulty sleeping, mood swings. These are all things that are difficult to verify. Delayed wound healing. Some of these clients will contaminate their own wounds. And then depression. Risk factors. Brain dysfunction. Impaired information processing in the brain. Or these clients may have a history of childhood neglect or abuse with frequent hospitalizations. As a child, being at the hospital may have been perceived as an escape from what was happening in the home. Clinical features. Unexplained illness despite comprehensive evaluation. Extensive medical knowledge. The client will use medical terms properly and ask for labs and procedures by name. They'll have multiple provider and hospital visits. Once they have exhausted care at one facility, they will find another, and another, and another, and another. They're reluctant for staff to speak with loved ones or previous healthcare providers because they don't want them to find out what's been going on. And clients may demand specific interventions and then become angry if those requests are not met. If laboratory and diagnostic results come back as negative, they will develop and report new symptoms. Nursing interventions for factitious disorder imposed on self. We always want to keep in mind their safety. We want to assess for comorbid psychiatric disorders. Do they have something else going on with their mental health? Are they experiencing psychosocial stressors like divorce, death of a loved one, being forced to move, or loss of a job? Are they doing self-harm? Again, remembering their safety. We want to give feedback in a supportive way rather than a confrontational manner. Confrontation is counterproductive with these clients. They will become defensive. We want to provide them with coping strategies to increase their level of functioning and to handle stress more appropriately without physical symptoms. The focus is on management of this disorder, not curing it. Nursing interventions for factitious disorder imposed upon another. We want to seek information from others, like teachers or family members. We need feedback from other sources to determine what is really going on. Does the caregiver report the child is ill at home, but the teacher says at school the child appears healthy? There'll be multi-specialty case conferences. The client may be telling different specialists different things. We need to approach this client with the same message to keep the child or older adult safe. Stop all unnecessary medical procedures for the safety of the child or older adult. And then report suspected findings to local authorities because this situation may require legal intervention.